Hello everyone, I'm Dr. Tom Mead and I'm an orthopedic surgeon. And I'm going to show you something here that may fall under the category of don't try this at home. But I am at home and I'm going to show you. I do have a swollen knee and I'm going to show you how to drain a swollen knee. Why would you have to do that? Well, you won't have to do that unless you're in the medical profession and maybe 1 in a million chance. But let's say you are an active person and you're out on a long camping trip, maybe in this country, maybe in another country, maybe hundreds or thousands of miles from any good medical help, and something happens to your knee that it becomes swollen. And it can really be, a life or death situation. What could that be? Well, let's say you have a fever and an infection and all of a sudden you had a scratch or a tick bite and your knee is swollen and it's hot and red. And really, you have to hike out or go hundreds of miles. So you have to drain your knee so you could be functional. And if you happen to have the medical equipment, I'm going to show you how to do that. You could fall on a cross-country bike trip in another country and your knee is filled with blood. You can't continue on the bike. You can't certainly walk. And this gives you an option to drain that blood, put a compressive wrap on. A couple other options I could think of where you would need to, but this is a short video. So it's already prepped. It would be nice to be sterile. I do have some alcohol here. And this is the outside of my knee. And you can see as I blot it, there is fluid in it. Now, I'm lucky enough to have a little bit of Novocaine that I could put a little pinch of Novocaine there. You may not have that out in the wilderness, but I just put a little stick of Novocaine right in my skin and you feel another pop, boom, that's the capsule. I go into my capsule and then, this is actually a good technique in the office too, but not to yourself. And then I just withdraw slowly and I inject the Novocaine as I come out right at the skin level. And this is a really small needle. And you see 1 drop of blood, which is always good because it gives you a target. And then, of course, there's a bigger needle to draw the fluid, or in some cases, the pus out. But you just want to go in the same spot, or it was useless to put the Novocaine in. And boom, I feel that same pop, boom, right into my knee. Right there, I feel that pop in. And then I know I'm in the knee. And then I draw, and you could see the fluid coming out. And really, it's relatively painless. And then I could squish the other side. And that's normal synovial fluid. In my case, it's due to a little bit of overuse, arthritis. And again, I'm just with one hand trying to drain that. And if that was pus, you would feel good. You could then remove this if you happen to have a liquid antibiotic or an anti-inflammatory, if it was blood. Or nothing, really just put a compressive dressing. But for an inflammatory issue, severe gout or something like that, you could inject it. And basically, that's how you can do it. So I hope that was helpful. Again, don't try this at home. This is for medical profession only. And I just gave an example. If you were in a third world country and you had to do this in an emergency basis, that's how you do it. Hope this was helpful. Thanks for watching.